The coronavirus vaccine arrives, but so does a logistics puzzle for the ages. How do you manage a limited supply of a medicine everyone needs? And what about those who don't trust that medicine? Are they right to wait, or do they need to be convinced to jump in? Today is Sunday, December 20th, 2020, and this is Flashpoint. Hi, welcome to Flashpoint and Merry Christmas as we head into one more big and yet quite unusual week. Chances are you're waiting for some cards or some packages to arrive because the mail has been overwhelmed this year. But to many, the most important deliveries came through last week, and those were the first shipments of the Pfizer coronavirus vaccine. They haven't come in time for so many people. Thursday, COVID claimed Sheriff Benny Napoleon, a man who basically spent his life serving Detroit. Benny died after we taped the upcoming conversation, so I would urge you to head to clickondetroit.com for the many remembrances and tributes to Benny Napoleon. His loss is yet another reminder of the damage this virus has done in communities of color. And yet, we began to see this past week, not everyone is ready to roll up their sleeve. Skepticism is generally healthy, but what's reasonable when it comes to public health? History shows us there is very understandable hesitance, if not outright cynicism, over government medicine in the African American community. But after Nation of Islam leader Louis Farrakhan this week referred to the vaccine as toxic waste, worries began to mount about the task ahead with getting vaccine help to the communities that have already been the hardest hit by the pandemic. What about you? Are you up for getting the vaccine as soon as it's ready? Do you want to wait a few weeks? A few months, a year, or are you a never needler? Marrying our own choices with the demands of public health today on Flashpoint. Well, the vaccines are coming, but just imagine the task of trying to send a piece, say, of mail to every single American, much less something as complicated as a temperature-sensitive 2-dose vaccine. Let's talk about getting everyone into the tent with Dr. Janae Khaldun, the state's chief medical officer, and Denise Fair, the chief public health officer for the city of Detroit. Dr. Khaldun, let me start with you because you got the vaccine on Thursday, which I guess says a lot to me about your level of confidence with what this vaccine can do and its safety.
That's right. You know, I've had the honor of working on the front lines in the emergency department throughout this pandemic. And I certainly understand what toll this pandemic and this virus has taken on patients, but also on our frontline healthcare workers, from our techs to our nurses, our doctors, our staff, both physically and mentally. I've even had 2 clinicians who helped train me in New York City actually die from this virus. So it's been an honor. As a frontline healthcare worker, I did receive the vaccine, and it's certainly something that I encourage other healthcare workers to get as well.
We want the healthcare workers to get it first, Denise, but the question that I know that I'm getting all the time has to be the one that you're getting all the time. How will everybody else be getting it? What are you telling people when they say, when can I get the vaccine?
Sure. So we're going to follow the state's orders. And so there is a phased approach. Most of the population won't get their vaccine until late spring. But our goal at the health department is to provide information so that Detroiters know what decision they should make for themselves. Now, I know I will be getting the vaccine as well when the time is appropriate, and not just for myself, but for my family as well as for my community.
Dr. Khaldun, talk then a little bit about how you're prioritizing. I think we all understand the fact that frontline healthcare workers who have been so heroic through this whole thing, that they need to be first. But then it starts to get complicated pretty quickly, doesn't it?
Yeah, we are following CDC recommendations for how we are allocating the vaccine across the Michigan population. And so we have several phases. I think it's important to note that the phases are running in parallel. So it's very likely that one phase or one group may not be entirely complete before we start with another group or another phase in the priorities. And so absolutely, first we're starting with frontline healthcare workers, emergency department, departments, ICUs, medical floors. And I think it's important to understand it's not just because those individuals are taking care of patients with COVID and maybe at risk of getting the virus themselves or passing it to others. It's also about making sure our critical healthcare infrastructure is well so that they can come to work and they can take care of patients who have COVID or non-COVID concerns. So that's the first group. Then again, depends on how much vaccine we get. We will extend that to people living and working in long-term care facilities. Then we'll expand out to our essential workers, onto others who are at higher risk for severe COVID-19 illness, so the elderly or people with underlying medical conditions. And then hopefully by late spring, we can have the vaccine be available for the general public. But again, a lot of this depends on the supply that we get from the manufacturer.
In fact, Cranes reported this past week that Michigan was going to be seeing a smaller supply of the vaccine in the second week than we got in the first. I suppose there's going to be just a natural ebb and flow of this, just the way that a supply chain works, right?
Absolutely. This changes literally by the hour. We've always said that this is an estimate. We don't really know how much we're going to receive, quite frankly, until we actually know that it's been shipped. And so it's going to continue to evolve. And yes, we did just recently, even last night, get information that the initial estimate for how much we were going to get in the second and third weeks, again, through December, was smaller than what they initially had estimated for us. Yeah. But it continues to evolve.
Well, I want to make the turn now with both of you into this vaccine will only be as good as the number of people who are willing to get it. That's kind of how this sort of community immunity will work. Denise, when you hear somebody like Louis Farrakhan call this vaccine toxic waste, and I know you're already hearing from pushback from some members of the community who just aren't all that eager to be first to sign up, what do you say?
Sure. So let's just talk about the issue of vaccine hesitancy. And we're seeing that particularly in communities of color. It's a natural response, I believe, to have a little bit of fear about something that's new. You think about the city of Detroit, we were hit hard early on.
Right.
We definitely were challenged. However, if you just take a look at where we are right now, we've made a lot of progress. And I do hope that people will take the vaccine. From what we know, it saves lives, but we can't neglect what we already know that works, which is wearing our mask, washing our hands, avoiding crowds, and really doing our due diligence, again, to protect ourselves and for our families. My goal is to share information based upon what has been given to me by the CDC as well as the Michigan Department of Health and Human Services. We are not going to push vaccines on anyone, but we do want them to be informed so that they can make the best decision for themselves.
Dr. Khaldun, let me let you weigh in on the same matter here. And to this idea of we're not going to force vaccines on everyone, do we get to a point where those who aren't willing to get it have to somehow be excluded from certain things? Or we start bumping up against a real personal freedom and personal choice issue here against the demands of public health, don't we?
You know, at this point, we are not considering at the state level mandating the vaccine. I think as Director Fair mentioned, it's most important that we get information out to the public. I think everyone has a right to ask questions. And quite frankly, I think in communities of color, they have a right to have some questions about the healthcare system and racism in the healthcare system and how it has impacted communities of color. But I also think it's important that we understand the facts about the virus. People get information, can ask their questions. But also, I think communities of color have to understand that this is a tool. And if we see that there are disparities as far as who is actually wanting to get this vaccine, the disparities we've seen and the death that has devastated communities of color is only going to get worse. So I do hope that our communities get their questions answered and then hopefully feel comfortable with getting this vaccine so we can fight this pandemic back.
Denise, to talk about the settings that I suppose at a certain point, this is going to end up being about local control and every local municipality having to decide how they're going to distribute this. When it comes time for people like me or other citizens to get this, where will we be going? A doctor's office? Are we going to work? Do I go to someplace like the TCF Center? Where do I go?
Sure. So our goal is to make sure that everyone who wants to get vaccinated can get vaccinated. And right now, there's an entire team of employees who are dedicated to developing a plan that works. In fact, we're going to launch the most efficient plan in the entire country, led by Mayor Mike Duggan. And our goal is to vaccinate about 5,000 people per day. We will have information available on our website, which will tell people where they can go. Traditionally, we will, at the health department, we'll get a very large allocation, and that'll be distributed to pharmacies, to local providers, to hospitals, to FQHCs. But again, everyone who wants one can get a vaccination.
And Dr. Khaldun, as you try and spread these vaccines then out across the state, is it a matter of where the population is? Is it where the hot spots are? How do you make the decision then about how soon Denise Fair gets her share?
So again, it all depends on the allocation we get that is determined at the federal level, but we're going to be using a lot of things, including the social vulnerability index. So essentially it looks at things like poverty, employment, things that really impact how people experience health and are able to obtain optimal health in the community. So we will be using that, similar to how we located testing sites across the state to allocate vaccines as well. But every part of the state will have access to this vaccine.
Dr. Janae Khaldun, Denise Fair, we wish you all the best on this terribly important rollout. Thanks so much for spending some time with us today on Flashpoint.
Thank you.
You bet.
Thank
Merry
you.
Christmas to both of you. We'll take a quick break. We'll back with more. We'll continue to talk about the reluctance of some in the community to be first in line for the vaccine. This is Flashpoint on Local 4.
Michigan, it's time for double the fun because DraftKings Sportsbook and Casino are coming to the Great Lakes State. Sign up early and get $100 towards blackjack and $100 towards any sports bet for free. As the #1 sportsbook and casino apps in the country, we've paid up north of $20 billion in payouts already. Sign up now because this offer won't last. Just download the apps, sign up with the promo code, get your $200 bonus, and make it rain.
For more than 90 years, inspired by the example of St. Francis of Assisi, the Capuchin Soup Kitchen has been privileged to serve people facing challenging circumstances. Today, the Capuchin Soup Kitchen has evolved to include programs like the Rosa Parks Youth Program, helping our local children through art and tutoring. We can't do this work without your help.
Thank you for being a friend to the Capuchin Soup Kitchen.
Always there for you. Come experience the Gowling difference at Gowling Alfa Romeo of Birmingham.
Shop with us online at alfaromeoofbirmingham.com for incredible offers from the comfort and safety of your home. During the Season of Speed event, lease a 2020 Alfa Romeo Giulia for just $279 a month, or lease the 2020 Alfa Romeo Stelvio for $349 a month. Don't wait. Visit alfaromeoofbirmingham.com today.
When they lost their parents to COVID-19, the community rallied around them. Monday morning at 6:30, grab a tissue. And don't miss the joy as a local police department shows up with a major surprise.
I promised you we were going to come bring Christmas to you.
I was so shocked and I was like, what's going on? Am I still dreaming or something?
On Local 4 News Today.
Detroiters support each other, so give local and shop local this holiday season. Together, we can make a difference.
All right, let's continue to talk about the vaccine and the rollout. And joining me to talk about it are Dr. M. Roy Wilson, president of Wayne State University, also an epidemiologist. Christina Zilke, down there at the bottom, is a registered nurse and the nursing supervisor at the Washtenaw County Health Department. And on the upper right, Portia Roberson, back with us again, the CEO of Focus Hope. Dr. Wilson, I've turned to you a number of times through this pandemic, so let me start with you. Really curious about your take on where we are in such a short amount of time to have arrived at the arrival of a vaccine, one that works very differently from vaccines of the past, which kind of seems to show us a little bit of the future of medicine.
Yeah, well, certainly it was very fast, and a lot of people are concerned about that. But I just want to, first of all, just assure people that just because it was fast does not mean that it's not safe. The reason why we were able to develop the vaccine so quickly is that years and maybe even decades of work have been going into the foundational research aspects that form the backbone of this vaccine. particularly on messenger RNA. And there were a number of people who have done real basic work, basic research on how messenger RNA can be used in diseases and make them stable enough so that it can be used. And the fruits of all that labor over these many years was just available when the time came for a vaccine to be made for this specific virus. But had there been a market for it, a vaccine would have been made using some of the same technology for MERS, for example. But that's the Middle Eastern respiratory syndrome. But that kind of petered out. That was in 2012. And no pharmaceutical company wanted to invest, huge amounts of money in developing a vaccine. That was when there wasn't a huge demand for it because it was petering out. But that same technology that was available then and would have been used to develop the MERS vaccine was used to develop this vaccine.
It is an important point that I'm not sure has been pointed out enough, that we did have these building blocks that were already in place that helped us get across the finish line here a little more quickly. But Christina, I'm curious, as you are talking now to we'll get to other patients first, but as you're talking to your colleagues in the healthcare world, everybody eager to get this, or are you hearing some reluctance from folks who maybe don't want to be the first ones in line to try this until they see how it works among a few other people first?
I think there's a lot of people who are very excited to get it, and there is a lot of hesitancy. I don't know that of healthcare workers that I know and work with and have talked to that they're like definitely a no, but they do want to have these questions answered about safety and efficacy. And, additionally, these rumors pop up that these side effects or long-term side effects, about fertility, for example, they've heard that, but they don't know where the data is to research that, or if it's true, or what they should believe. I think it's difficult to find resources that are reliable. And so I think mostly I would say people are excited to get it, but there are a lot of people that have questions.
No doubt. And among those people who have questions now as we move into the broader citizenry, Portia, as we were just making the point in the segment before, the community that has been so badly hit, the African-American community by this virus, is also one that is poised to be pretty cynical about the government coming in and saying, here's some medicine that's really good for you. So how do we start to create the trust that's necessary to move us forward?
Well, I think the first thing we're going to have to do throughout communities is to rely on the experts, the people who have done this work, who are medical doctors, to give us more information. And that will go along with reassuring people that the vaccine is safe. I think the hesitancy is justified. I mean, we know there are disparities in healthcare amongst the African-American community. There have been for many, many years. And I think, we've also seen the significant effect it had on the African-American community with regard to COVID-19. So I think the hesitancy is somewhat justified, the skepticism. But I do think that skepticism can be responded to with physicians and others who give us information as that comes available.
Dr. Wilson, I continue to hear people who suggest that this works the way that old vaccines do, that it has the virus in it, and I don't want to take that. But then, beyond just a misunderstanding of the vaccine, I'll ask you the same question that I asked Denise Fair. When you hear someone like Louis Farrakhan call this vaccine toxic waste, what is your reaction?
Well, first of all, I was not aware that he had made that statement. I would say that it's very unfortunate that a public figure who has so much influence, particularly over the African-American community, would make that kind of statement. The fact of the matter is that this vaccine has gone through a process that's been more transparent than any other that I was part of the FDA advisory panel for 14 years. Related to drugs and vaccines and devices. And so, I've been involved with this process, and this particular process for the vaccine for both Moderna and Pfizer has been the most transparent that I've seen. Just as an example, the FDA does not have to call an advisory committee for an EUA, but they did. And that's going above and beyond. They extended the follow-up period also. I mean, there's both in terms of safety and in terms of just the protocols. It's is most transparent that I've been involved with, or I've seen actually.
Christina, and yet, as I said at the top of the program, there's a lot of people who don't want to own the first edition, say, of a new model car. Let's let the kinks be worked out. I mean, it's understandable if some people are going to want to be waiting, even though, as a nation, we say we have been waiting for this answer to get us past this.
I've heard a lot of people say they don't want to be the guinea pig, right?
Yeah. And
unfortunately, that's just, it's a feeling that, well, if I'm the first one to get the vaccine after it's been approved, then I must be the first one that it's been studied on. And in fact, we've had such a huge group of people that it's been studied on. The original setup for the vaccines, for Moderna and Pfizer vaccines, was to have at least 15,000 people into the studies for the trials, and it was actually closer to 44,000. So they not only doubled it, they almost tripled it. So we're not guinea pigs. The people who are getting this vaccine are getting a vaccine that's been tested. I think one of the misunderstandings is when you see, this approval process happen so quickly, it's that the safety have been taken out. And for all vaccines, always, safety has been a part of every, phase of each trial. It's never skipped, and it certainly wouldn't be now.
Portia, I think the last time you and I talked about COVID, you were having a hard time keeping track of how many people you know who have had the disease. I think you lost count. I'm curious as to whether you're eager to get the vaccine.
I am. I have seen it decimate my community. My father unfortunately passed away about 5 or 6 weeks ago. Right. He was, we don't know that it was directly related to COVID-19, but he had tested positive about 4 weeks prior. And so, I know that we all have to make this effort to tamp down this pandemic that has ravaged this country and really the world. And so I'm ready. I think I'll be ready when it's offered to me. I mean, I have the luxury of probably not being one of the first ones to get it because I'm not a frontline person and I'm not a healthcare worker, so I won't be offered it right away. So I'll have somewhat of the benefit, I guess, if you would say that, to looking at how it affects the people who are getting it right now. But I think that, for me, we've got to do something. Because what we've been doing for the last 9 months has not been working. And I don't know if that's because people won't participate. And obviously we need people to participate in getting this vaccine for it to be effective. But I can't keep watching the numbers of people who are dying or the new cases every day. And, it's mind-boggling to me that people do not want to do everything they can to stop this thing from ravaging this world.
And I did want to quickly mention you. I know you've heard, Portia, from so many people with great memories of your father, who was a judge on the bench in Detroit for so many years. Dr. Wilson, are you eager to get the vaccine?
Sure. First of all, just as part of a societal obligation, I think, in order to really be able to beat this virus, about 75% of the adult population probably needs to have antibodies. About 10% will probably have it from naturally getting the COVID-19. So you need an additional 65 to 70% of the population to get it in order to, for this to work. And so if we don't take it, it doesn't matter that we have good vaccines out there that are highly efficacious in clinical trials. It's not going to be effective in the population if people don't take it. And so yes, I'm ready to take it and get out there and start being as normal as possible in terms of my daily activities.
In fact, you point, though, to another problem, which is people letting their foot off the brake a little early here because they know the vaccine's out there, even though it's going to take a while to get that around. Christina, as an RN, are you already scheduled to get it yet, eager to, or not quite yet?
I'm scheduled to get it, and I'm really excited. I don't have to wait for other people to do it because I will be vaccinating others and working in the vaccine clinic. Yeah, that's going to happen soon, and I'm really excited about it.
Good deal. Great conversation with all of you. I so appreciate the time. Merry Christmas, and stay safe.
You too.
You got it.
Thank you. You too.
We'll wrap things up with Flashpoint right after this. Don't go away. This is Flashpoint on Local 4.
Shopping for a home in today's market can be exhausting. Viewing homes and getting your offers rejected can get annoying. Now there's an easy way to shop for a home without the stress of having to sell yours first. Introducing YouPraise Offers. Enjoy the convenience of shopping for a home knowing that you have a cash offer waiting for you once you find your dream home. With YouPraise Offers, you can safely shop, and if you don't end up finding your dream home, you don't have to sell to YouPraise. Save time, save hassle, and home shop with the help of YouPraise.
Hi, I'm Kirk Mays, CEO of Forgotten Harvest. We help people every day who struggle with their most basic need, food for themselves and their family. Forgotten Harvest is hard at work, providing assistance to food insecure families in Metro Detroit, particularly those facing hardship due to the COVID-19 crisis. My request to you is simple. We hope to have your support as we continue our work to help those with the most need in our community.
Star Lincoln is celebrating 50 years thanks to you. The Star treatment continues on elevating your personalized luxury experience. Shop in person or online with complimentary remote delivery because making life effortless is what Star's about. Don't just shop for luxury, experience it. At the iconic Star Lincoln in Southfield, conveniently located 12 Mile and Telegraph. Get the Star treatment at the one and only Star Lincoln in Southfield.
There is nothing like home for the holidays, and our wish for you this season is for it to be happy and healthy.
Show your loved ones you care. Support your community by shopping local. Donate to a local food bank.
Order carryout from a neighborhood restaurant.
Stay connected with loved ones safely.
It's a time to remember, a time to celebrate,
and cherish all of the good things in life.
Happy holidays from all of us on Local 4 News and Click on Detroit.
Just about out of time for this morning. I want to quickly direct you to next Sunday morning's program as we draw closer to a new year and a new administration. Is there a chance for a new start for American journalism, since so many Americans feel like the press has let them down? I think we can look forward to a fascinating conversation on that coming up next Sunday morning. Thanks so much for being here. Stay safe. Have a very Merry Christmas. We'll see you next time for Flashpoint.